I've often thought that caregiving should come with a warning label because so many caregivers have a very generous soul and it doesn't take them long to become overwhelmed because they want to do so much. So what would I warn them about? One of the first things I would warn them of is what I call compassion fatigue. Some people call this burnout or being stressed out, but it doesn't take long when you really engage the whole journey of caregiving to become overwhelmed with so many things coming at you. One of the things is coping with illnesses and diseases. It's not uncommon today to find an individual in their 80s suffering from 3 chronic conditions. So you might be helping them contend with conditions such as diabetes, osteoporosis, arthritis, heart disease, or even dementia. It doesn't take long for an individual with any of those kind of chronic conditions to have a change in their body status, and as a result, you're scrambling to begin to take care of them. You're also finding that with caregiving today, many people, many caregivers, are juggling multiple roles. They're working, they're raising children, they have to meet the demands of their family, their relationships with their spouse and other loved ones, and it becomes very difficult. Oftentimes you'll see today that the average caregiver won't take long for them to be spending up to 20 hours a week. It's like another part-time job. And there's well over 1 million people who are caregivers in Pennsylvania alone. There's also the financial strain with caregiving. It doesn't take long for expenses that are out of pocket to start adding up, where Medicare won't cover it, Medigap, or any other insurance policies. Even paying for things such as a TENS-DALT briefs can really add up. Beyond that, there's the care that's involved when you go to live in assisted living, and those prices can range up to $3,000, $4,000 a month. Or if an individual needs skilled nursing care, and they're past their 100 days with Medicare, they'll often find that those prices can range up to $350 a day. Caregivers often don't realize how much family dynamics affect their caregiving. Rarely is there just one issue at stake. There's often 3 or 4. And one of them at the core is dependence versus independence, especially between adult children and their parents. The older parent wants to remain independent for as long as they can, but sometimes the adult child might be very concerned about them, especially if they have dementia or other conditions, because they begin to worry about their safety. And so at the heart of some conflicts will be the debate between someone remaining independent or dependent. There are also multiple parties involved, especially if you have siblings or a family is rather large. Different individuals are going to have different opinions on how problems should be solved. Each member also has a different relationship with that caregiver. And this is something that I often tell siblings, because many times we think, well, we've all been raised with the same family and the same parents, so we have that same relationship. But of course we don't. Because there's so many moving parts and each member has a different relationship with their parent, and there's different decisions to make, sometimes I've seen where family members just get that kind of deer caught in the headlights look because they don't know what to do. And as a result, they sort of step back, and then inertia sets in and no one does anything, which of course isn't in the best interest of the person you're providing care for. Emotions often run high when it comes to a wide range of caregiving issues because there's a lot at stake, an individual's independence or dependence, and it's a lot at stake too in terms of your relationship with the person that you're providing care for. So you can count on emotions running high, and sometimes that will surprise you. And for the thousands and thousands of people who are struggling with dementia, their caregivers find that there is no such thing as normal any longer, and they have to constantly adjust. As soon as they think that they've understood what they need to do and get into a routine, something will change with that individual status, or they'll slip farther and farther into their dementia, and causing the entire family to regroup and find a new normal. So how do you manage all of these issues? How do you manage your caregiving? Well, the first is to keep your loved one in control. Start off by making sure that you're carrying out their wishes. And so you can start a conversation with them, such as, Dad, I really want to know what your wishes are, so that in case you aren't able to express what you want or need in a hospital, I'll know what you want. I want you to remain in control. So if you approach them that way, it's not about you taking over or telling your parent or your loved one what they need to do. One of the ways of knowing their wishes, and it's what I call playing out what-if scenarios. So you'll ask your parent or loved one, what if, Dad, you were in the hospital, you had a stroke, and you're going to have to be discharged in a couple of days, and they want to place you in a skilled nursing care center, and it would be temporary while you recover from that stroke. Well, where would you like to go? Or what hospital would you want to go to? Who's the doctors that you have been seeing? If you're going to receive some care in the home, what would you like in terms of that kind of care? If you play out those what-if scenarios while an individual is well, then they're not going to be so threatened by really exploring some pretty honest and candid answers. The other is to put together what I call the paperwork. And the paperwork that everyone should have is a durable healthcare power of attorney, durable mental health care power of attorney, and a living will. These are all forms that you can receive from an elder care lawyer. Some of these you can even access on the internet and fill them out as long as you have witnesses. You should also use an elder law lawyer to help with the will and a trust. Everyone should have one. Another very helpful tool is a personal property memo. This is basically a list of gifts that your loved one wants various family members to receive, and it takes out the uncertainty of who is to receive what. Next, I'd like to review 5 let's get to it steps. Get physical, get mindful, and get on top of drugs and medications. Get organized, get informed. So let's start with the first one, get physical. The first thing you want to do is to find a primary care doctor to coordinate your care. The older individual today is confronted with what I call body parts medicine. If you have a heart condition, you're seeing a cardiologist. If you have a foot condition, it's a podiatrist. If you have an eye problem, it's an ophthalmologist. It's all these different ologists that older people have to see. So you're going to be organizing much of that care and meeting with these different doctors. If you find someone who provides that primary care and they're an organizer of that care, kind of like an air traffic controller, that will make providing that care much easier. Prescriptions can also be used as creative solutions where you can ask your doctor to write a different kind of prescription for your loved one, and you think it would be very important for her to attend a support group. You could approach her family care doc and ask him or her to write a prescription to get your mother to go to a support group. She'll often listen to a physician, perhaps before she's going to listen to you. You can also use them for other reasons too, such as asking you to watch a video or your loved one to watch a video to better understand how to manage their diabetes. Or you could use it for respite care, maybe 3 hours a day. You could also ask the doctor, for example, to write a prescription for adult day center services, so that would assist the parent who is providing the care so that they can receive some respite, but it also provides very good therapeutic care and activities and socialization for the older person, perhaps suffering from dementia, by going to an adult day center. So be sure to use that as an added tool with your physician. Getting a geriatric assessment every 2 years by a board-certified geriatrician is also a very wise thing to do, especially if your loved one is in their late 70s or 80s. You can find these oftentimes at hospitals that will provide geriatric assessment clinics. Also, you're going to want to do reconnaissance on medical conditions so that you're better prepared to ask questions and you'll be familiar with the kind of language that when a physician speaks to you, this will be something that's more familiar and you can prepare good questions. I often recommend a very excellent website which is called medlineplus.com. Or it can also go under .gov. It's a government-sponsored website that provides excellent information, not just on conditions, but on medications as well. You'll also find good information with disease-based national organizations, such as with the Alzheimer's Association, or the Diabetes Association, or the Heart Association. Go to them for very good information. And support groups can be extremely helpful, especially if you're managing a very tough chronic condition. And that can be helpful not only for you, but for the loved one who is dealing with that condition. Finally, you're going to want to keep your parents fit. And you can keep them fit no matter what kind of condition they are. So if they are in a wheelchair and they have to do all of their exercises in a wheelchair, play some music, do whatever you can to get them to move and to gain some muscle strength. And it's also something that's very enjoyable for them. Over 300,000 people every year fall and break their hip. and it's something that can send them on a downward trajectory to institutionalization. So you're going to want to make sure that your parent or your loved one that you're providing care to is doing some sort of exercise to strengthen those muscles. The next is get mindful. The brain is actually the most greedy organ of the body, so it needs you to exercise to generate oxygen and blood flow. So it'll be important for your parent or your loved one to exercise and also to eat well. Older people do find that oftentimes they have problems with sleeping, but they're going to need that sleep to be able to recharge and replenish their brains. But oftentimes they're also faced with conditions such as apnea, snoring, and sleeping pills. Though people think that this is what's going to help them sleep, sometimes it will do actually the opposite. You're going to want to also monitor prescriptions, especially antihistamines, which will actually block memory rather than help that individual with the flu or a cold. It is something that can really prevent them from remembering and cause confusion. Other conditions such as hypothyroidism and vitamin B12 deficiency will actually mimic symptoms of dementia. So it's important to convince your older person that if they are showing signs of confusion, to take a look at their prescriptions and get them to go to a physician, because maybe it is as easy as something to fix, such as a B12 deficiency. Depression is one of the most missed diagnoses among the elderly. And part of the problem is our view among physicians who think that this older individual who has just suffered perhaps a loss of a job, they've also lost a spouse, they've lost their mobility, they might be losing some of their sight. And so the younger physician might begin to think, well, I don't blame them. I probably would be depressed myself. And as a result, we're really not dealing with levels of depression that we should among older people. Of course, they're going to feel sad, and that can be normal, but there are oftentimes points where that actually can become clinical depression. So it's important to observe and talk and ask questions to find out if that is a problem. Alcoholism, gambling addictions, and suicide are something to take very seriously among the elderly. A lot of people don't realize that suicide rates among older men are actually the highest among any other population segment. Ask, talk, and observe your loved one's behavior. See if they've actually experienced a loss of appetite. Have you found them stop talking about going out with friends or taking part in hobbies that have always been very important to them? Those could all be signs of depression or other kinds of health conditions. I think one of the most important things we all can do is to help an older individual feel that their life is meaningful. Even an individual with dementia can still make decisions. They can still decide what they want to wear today or what they want to eat. Also, for those individuals who might not be suffering from dementia but who are independent and living alone, they too need to know that they matter in your life. I often recommend to families that, if you have a grandchild, an adult grandchild even, to call their grandparent and ask them for advice or get them involved in a homework assignment. It's just so important for them to know that they still matter in your lives. And finally, when it comes to being mindful, remember that the answer always isn't in a pill. Our next step is get on top of drugs. More drugs and prescriptions lead to more likely side effects. If an individual has 3 or 4 chronic conditions, it doesn't take long for them to be on 5 different medications. And if they're on 5 medications, it really increases the likelihood that they're going to have some sort of adverse event or side effect contradictory to the other drugs that they're taking. You don't want to jump to conclusions, especially for those drug reactions that are going to mimic dementia. I've often seen where an individual will show signs of confusion or irritability, they can't remember, they start to lose their gait or their balance, and as a result, family members will start to think, oh my gosh, my loved one has Alzheimer's disease, and they begin making decisions based upon those kinds of observations, when in actuality, it could just be the medication that they're taking or how those different drugs are interacting with each other. Another important thing to remember is that people do not share pills. And though your parent might be independent and they're off at a senior center and you think things are just fine, I saw very frequently when I used to visit senior centers as a secretary of aging, where some older folks would think they were doing each other a favor by sharing them pills that they decided they didn't need any longer, or perhaps they didn't have a good reaction to, but they thought, when they listened to their friend and she told them the kinds of symptoms they had, that, gee, that was familiar to me, that's the same thing I had, maybe you would like to use some of these drugs and that will save you some money. Sharing drugs and prescriptions are never, never a good idea. It's also helpful to explore alternative medicine. Sometimes acupuncture can be something that's extremely helpful for an individual rather than be on a medication, or to try chiropractic to see if that will help, or reach for a heating pad or ice and to see if that will help with the pain rather than reaching for a pain pill. Over 100,000 elderly are hospitalized each year due to drug reactions. Get organized. You'll want to create a system for the medications that you need to keep track of, all of the contacts of the different healthcare providers you're working with, and the conditions that your older individual is faced with. Every specialist needs to know what the other is doing. And the way our health system is organized today, or actually I should probably say disorganized, regretfully, it's really going to be up to you to make sure that they have all of the information in front of them, especially when your older loved one is seeing a number of different physicians. So it's important to bring forms and information to the doctor's office so that they know the different doctors that your loved one is seeing, the conditions that are being treated, and all of the medications that they're taking. If you'd like, I do provide forms on a medical biography, emergency data, and a MedMinder on my website that are totally free that you can access at any time. Chances are you're going to be interacting with many medical providers. So you want to ask one of them to be the quarterback for you, to be calling the others on your behalf and your loved one's behalf when you need to coordinate care. You're also going to want to ask to get copies of lab and test results. But one thing that I think is very important to remember is that never assume that no news is good news. Some doctors' offices might tell you, well, if we don't get back to you, everything will be okay. But oftentimes they're seeing a great number of people and you can fall through the cracks, and they might think that you had been given that information. I always recommend to families that you should call about 4 days later or ask the doctor's office before you leave who you should call and in how many days, and be sure to follow up with that call to see if those lab and test results have been completed and what they are. I'd also recommend that you take all of your drugs to the general practitioner for a drug checkup, perhaps once every 3 or 4 months, or when new medications have been added. I think it's very helpful if your GP actually looks over those medications to make sure you aren't taking something that's contraindicated or isn't on the list, or you didn't know how to list it accurately. Our final let's get to it step is get informed. And the group that you want to get to know is the Aging Network. And it begins with the area agencies on aging. There is practically one in every single county in Pennsylvania. And that agency is there to provide coordinated care within a community and to also plan for the services that are needed for your loved one. You can find your area agency on aging by looking in the blue pages of your phone book under Government Services, and also to call Elder Care Locator. It's 800-677-1116. This is a national phone number, so that if you have parents who are actually in another state, they live there or they're visiting there, and you need to contact the Area Agency on Aging, you can call that number and they'll let you know of the one that's closest to you. One of the most helpful programs is a caregiver support program, and you'll want to call the Area Agency on Aging to access that program in terms of the services that you and your family member can receive. There's also the PACE prescription program that helps with medications, insurance assistance with the Apprise program. This is a terrific program, especially when you're in the midst of dealing with open enrollment and you don't know whether or not what kind of Medigap policy to sign up for, or should you stay with original Medicare or to opt for the Advantage plans, or perhaps you've gotten different bills from Medicare and you just totally don't understand those. or you've gotten different bills from Medicare or statements and you're not sure what those actually mean and whether or not you should pay them, you can call an apprised volunteer and they'll help walk you through that entire process. And again, this is something that's provided through the Aging Network and the Pennsylvania Department of Aging, and they have local programs near you. There's also the Options Program, and with this program, it provides different options for family members to care for their loved ones at home when they have skilled nursing needs, and they actually could be eligible to be in a skilled nursing facility, but instead they're opting to remain at home. Again, call the Area Agency on Aging to see if your loved one qualifies for those services. Your local senior center can be a terrific friend for your older loved one and for yourself in terms of the kinds of services that they provide, the socialization, and the terrific information that they provide so many family members when they're providing caregiving. You can also call in Pennsylvania the Long-Term Living Helpline at 866-286-3636. There's someone waiting to help you understand all the different services and programs and some of the eligibility criteria for caregiving services for your loved one. One of the most common issues that caregivers face is dealing with living arrangements. In the past, we used to think that there were just two options. Either people stayed at home or they were placed in a nursing home. But today there are so many more options available to people. You can live on your own. It can be at an independent living center or in apartment housing. It can also be in your own home where you provide different services to make it possible to stay there. Or it can be with shared apartments. And there's even something that's called eco housing, where you can actually place and construct a pre-made cottage right on your property. There's also semi-independent living arrangements. Assisted living is one that many of us are familiar with, and sometimes that can cost between $3,000 and $4,000 a month. In this situation, an individual receives room and board, oftentimes their meals, and they'll have some recreational services that are provided to them. Some of them provide transportation. But it's important to know that this is not a kind of service that provides one-on-one care. There are also CCRCs, continuing care retirement communities, and life care programs where individuals pay upfront a rather substantial fee to be part of a living community. The benefit is that they'll be able to receive all levels of care, whether it's home health care, assisted living, or skilled care, all on one campus. And finally, there are living arrangements that are care-focused. And in this situation, you'll find skilled nursing care for individuals who are recovering from a particular condition, say for instance, a hip fracture or a stroke, or this will be individuals who will stay there for the long term because they require long-term care. There are also adult day centers that provide care, therapeutic care, and activities, recreational activities throughout the day while you're able to go to work, or why, let's say, for instance, your mother is providing care to your father who has dementia and she really needs respite care and he would benefit from the care during the day. In addition, there's home health care, where that care can be provided in the home. That's usually very helpful after a post-hospitalization to help individuals recover. Most people, of course, love to remain at home. And if they're living alone, there are a lot of services and technologies today that can make that possible, even for individuals who are suffering from mild dementia. The first thing is you're going to want to assess their ability and options to be able to be at home. There's a number of high-tech things that are available today that can be extremely helpful. One, of course, is the old standby of the personal alert systems that you're able to wear to be able to notify someone that you have fallen. There's also some new developments in that field where I've seen with life care, they actually now have sensors that are placed in those personal alert systems so that if an individual falls, it actually detects the trajectory of the fall. So that, say for instance, they had a stroke and they're not able to actually push the button is going to go off automatically because of that sensor. That's a new technology that I think is extremely helpful and valuable. The other are life sensors that are placed throughout a home, so you're able to see whether or not an individual has gotten up out of bed, if they've been able to, if they've gone to the bathroom, taken a shower, and they've actually left so that you know they've left the bathroom. Or you'll see you can actually place them in front of where they take their medications to make sure that they've actually taken them. And that information, there's like little signals with that can actually be sent to family caregivers, and it can be sent anywhere. So you can actually get a text message that your mom and dad has taken their noontime medications. Again, something that's very helpful. And as you can see with this gentleman here, he's using a telehealth service where he can take his blood pressure and have that sent to a nursing station someplace else. This is something that my father has been using. He's 92 and lives alone. And we have him now working with the program with the VA Health Center. And every day his blood pressure and his weight, and he's answering different questions, are all sent to a team at the VA that monitors his health every single day. There are also pill dispensers that are available that are electronic. So for those individuals that are taking 5 or 6 different medications at different times throughout the day at different dosing levels, this is something that can make it much more easy for them to keep up with the kinds of drugs that they've got to take. That's on the high-tech side of providing care. But there are also a number of alternatives out there today to provide high-touch care. One of them is through these non-medical senior care agencies, groups like Home Instead, Visiting Angels, Comfort Keepers, Bright Star. There's a good number of them that are available today, and you can find those in the phone book, usually under home care. With these programs, they're able to send someone in who will provide all of the care that they need that is not related to any kind of nursing care. So they can remind someone to take their medications. They can help perform light chores throughout the home. They can accompany your loved one to doctor's appointments, take them to doctor's appointments, pick up prescriptions. And one thing that they can also do is to provide companionship. So that if you notice that your loved one is really homebound, they're not getting out that much, it might be very helpful to them if they have someone who's coming every day or every other day, having a meal with them and sharing in perhaps playing cards or some other hobby that's really important to your loved one so they remain active. It really is a stitch in time. One of the most valuable things that you can do is to create a support system. And I know at times it must feel like, I just don't have the time to do that because you're in the throes of caregiving. But it really can save a great amount of time and stress later, especially when a crisis might hit. If you live a long distance from your parent, there are a number of things that you can do so that you can be better organized and to be able to assist them. One thing that might be helpful is to bring back a phone book. Of course, today you can access so many different services and phone numbers online, but you're going to want to know where the chore services and how to contact them, or the pharmacy or home health agencies. So it's good to have that on hand. The other is if your parents are close to their neighbors or they know the neighbors, always stop in to say hello to them when you visit your parents, and to let them know that they can feel free to call you in case they think there's something that maybe you should know that would be of assistance to your parents. Find out if your parent trusts them enough so that they could have a key, so in case there might be an emergency, they would be able to get in. One of the things when I visit my parents, whether it's in Phoenix or up in Erie, Pennsylvania, is that I make it a point to attend to one of the doctor's appointments of my parents, or have them schedule it when I'm going to be in town. I always get to know the nurse manager, and I share with her my contact information so that if she feels she needs to call me, she knows that she can, and at least she might connect me with a person and a voice the next time I need to call her. You also want to know the home health agency that your parent is going to use in case you need to make phone calls to arrange for care. They might have the flu and you need to call someone to come in and take care of them. It's good if you have all of those numbers and that in play ahead of time. It's also helpful to know a chore person that you can call, to get to know the pharmacist. And another individual that a lot of people don't realize can be a terrific resource is the mail carrier. Oftentimes, they're going to know your loved one's schedule better than you are. And there is a service with the post office whereby you can ask that the mail carrier notify the local area agency on aging if they think something is amiss. It's something that can be extremely helpful. A service that a lot of people don't realize exists that can be extremely helpful if you're caring for a loved one from a long distance are geriatric care managers. Many times they are social workers or nurses in a private practice, and they provide case management. They will make arrangements for doctor visits. They'll go to those doctor visits. They'll help you with the paperwork and organize the kind of care your loved one needs. They'll even make visits to the hospital to make sure that they're being well taken care of while you're en route getting there to see your parent. Area agencies on aging, I've mentioned before, they're a very important resource for you to access all kinds of services, so get to know them. Non-medical senior care, we talked about that a little bit earlier. Again, that can be a terrific resource for you and a support system. It's also wise to share visit schedules with your siblings. That way your parent can have their coverage more widespread. So one example I've used is that in our family, we have it set up where on Monday nights, I call my father. On Wednesdays, it might be my brother. And on Fridays, it could be my sister. And that way, throughout the entire week, mom and dad are receiving phone calls. And we do the same thing when it comes to actually scheduling visits with our parents. And faith-based services are also a terrific resource to add to your support system. You don't always have to belong to a congregation or a synagogue to tap into those services. Many of them offer friendly visitor services, which can be a big help to your parent. They might be able to provide respite services, transportation services. So don't forget to call on them if you feel you need some added help and some support for your loved one. And now we're on to our final point of our Caregiving 101 series. Make it a family affair. Rarely should caregiving ever be a solo act. Even if you're an only child, you can still reach out to friends and other extended family members to assist you. You want to share your tasks with your relatives. Focus on the needs that match the skills in your family. Oftentimes that might mean forgetting birth order. In my family, it's my younger sister who's the nurse, and so she's the one making a lot of the calls to different physicians to get reports on my parents. I'm the firstborn, so in the past, oftentimes I've been the one that my little sister has looked up to or asked for answers. But in this situation, I've learned to match those skills with my sister. If you have siblings that live long distance, it doesn't mean they get to be missing in action. There are plenty of things that family members can do, no matter where they live, to assist with caregiving. It's really important to keep the communication channels open when you're providing caregiving. Call meetings with other family members. Do three-way phone calls if you need to. You can do conference calls, email each other. You can join websites where you can provide information to each other and keep all family members posted, especially when someone is going through a very tough patch. Care Pages is terrific for that kind of resource. You can also use Skype, which is a wonderful thing for those loved ones who lived in skilled nursing facilities. If you're able to take your laptop and Skype other family members to them, it makes them feel so much more connected. Reach out to friends and neighbors and faith-based groups. Let people know that they can help you. When someone comes to you and says, "Gee, I really want to do something, what can I do?" I recommended to family members to have like a little list or even cards that they can share with individuals, so when they do ask, you have something for them to be able to do. And finally, one of the most important things to do is that who is ever providing the care, whoever that primary caregiver is, if it's you as a spouse or if it's your parents providing care to another parent, really look out for that caregiver. Provide them the support. Make sure that they're not suffering from caregiver fatigue. And if you're the caregiver, you're the primary caregiver, it is so important to take care of yourself. And I know that seems counterintuitive, and there are times where you feel like I just don't even have the time for myself anymore. If you're saying that, then chances are you are going to suffer from compassion fatigue. You will be burned out, and it will become too stressful. So be sure to take care of yourself. Congratulations, you just completed Caregiver 101. Again, thank you for attending. And may you and all those you love age well.